So we have initiated the recording. So first of all, I just want to thank all of you for being here, and just wanted to start with an introduction. So my name is Hassan Nawas. Some of you know me, some of you have are seeing me for the first time. So basically, I am a medical doctor, and then I've done a FCPS in community medicine. Previously I was a faculty in Aachen University. Currently, I'm in Saudi Arabia. I am part of multiple research groups that are related to digital health and artificial intelligence. I have been publishing in this area for a while. Our research groups have been working on developing multiple avenues for publication. So we have initiated projects of capacity development, like training people across Pakistan for meta-analysis, or training people across Pakistan in R and Python secondary data analysis. But one of the limitation that has come across over the years is that even though we have been able to increase the capacity, but we have a huge rejection rate in terms of our papers. Now, initially, my thought process was that maybe we are having this rejection because of a lack of capacity or lack of quality. But uh, over the past 2 years, we have dramatically increased the quality of work. We, at the same time, have gotten our work reviewed by international reviewers, but still the rejection rates were very high. So one of the key thing that I came across, because I attended a few webinars in this area, was that because we were applying for low income countries, and because low income countries generally tend to apply for fee waivers, so the journals tend to not be that appreciative, or the journals have a high rejection rate for those who are unable to pay. Now, this I'm referring to the open access journal, not the subscription based journals. In the subscription based journals, still, what journals would do is that a lot of times they would ask us, you know what, you require this editing service, even though that was not needed. But if you would take up that editing service, they would say there is a guarantee that you will be published. And then that editing service would be somewhere around $1,000 or so. So it would come across um, almost the same amount as the open access journal. Previously, in the previous years, that doesn't mean that we have been unable to publish. In previous years, my group and myself together, we published around 12 papers. This year, we have submitted around 28 papers. Three are already published, and then others are in the process. Most of my work is around digital health and artificial intelligence. That doesn't mean that all of you should be working in that area. Absolutely not. Because of this and a lot of discussions I had across Pakistan with multiple researchers, we came up with this conclusion that the only way forward is to develop our own journal. And if we develop our own journal, then what that would mean is that, first of all, this gives a platform to the researchers in Pakistan. At the same time, if we are able to develop one journal leading to another, multiple journals, and eventually a publishing house, what that does is that then we are able to invite foreign researchers. When I say foreign researchers, I mean researchers that are based in the Western Hemisphere. So those researchers can then also be part of it, can also publish in our papers. Obviously, that would require that we have a high citation index. That would also require that our journals end up with indexation with PubMed, Scopus, Science Direct, Sinahil, Web of Science, all that. So we are progressing in that direction. So with that being said, the reason that we called this meeting, the reason we initiated the whole journal thing was that we cannot do this alone. So we need support in this. So what do we need? We don't need financial support for this, because the indexation process, it requires somewhere around $2,000 to $3,000 per annum for various indexations. So that is something that we can manage in our group, no problem. What we want is, we want collaboration with multiple medical institutions across Pakistan. And I'm doing this starting with Pakistan, and we will have a similar, like the similar meeting that we are having, we will be having something similar with Saudi medical colleges as well as a starting point, because these are where I have the contacts. And what we're going for is basically the reason for these meetings is to, yes, first of all, get to know which medical colleges might be interested. We'll create a Google form and we'll share the Google form in the WhatsApp group as well with you guys so that you can write down your details and the details of your college so that we can then reach out to you and you can become a formal team member of this. We at the same time, so we want some sort of physical space in every major region of Pakistan. And when I say region, I basically mean areas that are medical college clusters, and most of the medical college clusters are based in big cities like Karachi, Lahore, Islamabad, Peshawar, Quetta. And then in South Punjab, you can maybe focus on Bahawalpur or Multan. And then in Azad Jammu and Kashmir, we can focus on maybe one area, one city like Muzaffarabad. So the plan is that we identify faculty in all of these areas, and the faculty does our advocacy in the university. At the same time, the faculty in this college becomes part of our editorial board. If the faculty becomes part of our editorial board, what that does is that from that college we can offer two publications every issue that we have. So we are planning to have four issues of the journal. So four times the journal will be having an issue throughout the year. So every 3 months, and in those issues, our plan is that. We give at least two publication to the participating medical colleges. At the same time, we want the medical college to at least provide us with a supporting staff. It could even be in the form of a dedicated medical student, but there should be some form of responsibility, as in like we require some dedicated hours per week, somewhere around 10 hours per week. Initially, there would not be a lot of work, but later on there would be work. So what this does is that this will get the ball rolling. At the same time that we are working with the medical colleges to establish setup with all major regions of Pakistan, I just wanted to let you guys know that we have developed the journal system. How did we develop it? We use something called as the Open Journal System, OJS. And my technical person is not here, Mr. Asad. So he has already developed it. We have developed the website. Initially, we actually developed this like a year ago, but we wanted to like launch it properly and we wanted to get the indexations first. So we have some subject matter expert in terms of indexation, especially people who have been working with publishers like Elsevier and Bentham Science. So we have one person like that. Her name is Miss Madhia. So she will be taking care of the indexation part. At the same time, we have people in our team like Mr. Amir. He's also here in the meeting. So Amir, thank you for joining. So Amir looks after a lot of the grant work that we do, and also at the same time, I have requested Amir to take a leading role as a general manager for this journal. So, Mr. Amir is a master's in health policy management from Khan University. At the same time, he's a published researcher. At the same time, he has been working in the area of digital health. So, with that being said, what do we want from you guys? What we want from you guys is number one, that please engage your medical college, see if they are willing to be a partner in this. We will create a Google form which we can give to you the link, and you can ask. We'll ask you for certain details. You can, if you can get those details, what we can do is that we can start off the process of initiating a partnership, maybe signing a MOU with a medical college. So what that does is that once we have institutional buy-in, institutional endorsement of this work, that would make it very easy for you to reach out to your students and ask them to publish in this journal. As we move forward, obviously within a year or so, we are trying to get as many indexations as possible, and then obviously rate increase the impact factor of the journal as we move along. Eventually, first get impact factor and then raise it to as much as we possibly can. This is not a short process. This is a long process. This process will require somewhere around 2 to 4 years, where we are actually in a position where the journal actually is looked out by people, sought out by researchers. This is a nutshell, in a nutshell, what we are trying to do, what we are trying to offer, and this benefits the medical college, all the participating medical colleges who become part of this initiative. What we will do is that every time that they have a research conference, we will issue a whole gazette for that conference. So that is something that we can do. So their whole conference will be published. A lot of time these conferences happen and then they are left behind unless the paper is already published. So we can publish conference proceedings for the participating medical colleges. I have been a vocal advocate of establishing and research across Pakistan and democratizing research. So, for that matter, we have been working with multiple partners. There is one question. So, I think this is in a nutshell the introduction. We can now take a few questions. When you ask a question, I will just request that please first state your name, and then you can then go tell about your institution and also your designation, and then you can ask any question. Or you can also give not just any question, you can also give any suggestion if you want. So, in the chat box, I can see that Dr. Saira has asked a question. Is it going to focus on undergraduate research only on postgraduate as well? This is the name is Health Innovation Journal. So we focus on undergraduate, postgraduate, within postgraduate, whether it is a residency or a master's or a PhD, it doesn't really matter. We focus on journal. We can later on create a special section, a student section, like a lot of journals do. So later on we can do that to facilitate undergraduate students. But at this point, we are working with everyone across the board because at this point it's just a matter of establishing the journal. Also, like I said, this journal focuses on innovation. Later on, we will go for specialty specific journals. We will keep on developing them. And obviously, we will register a publisher. Hopefully, we will register it both in Pakistan and also in Saudi Arabia, Riyadh. So, this will be an ongoing conversation. The WhatsApp group that we have created will be where we communicate with everyone, and it will be sort of like an informal communication with all the faculty. Any faculty has an issue, they can post a question in the WhatsApp group, and then we can move forward from there. I have been establishing startups for the past 8 years. One of my startups got funded, got incubated at Nest.io, which was a Google funded incubator. Now the incubator has closed down. In Saudi Arabia, also I have established a few initiatives. So I have been doing this for a while, so I have some idea of how this process works, how process of company registration, or how the process of indexation of a journal, or how the process of just establishing a research society works. Alhamdulillah, we have capacity in Pakistan. Alhamdulillah, we have great researchers in Pakistan. And I think it is high time that we develop our journals and this is not something that we are doing for the first time, and it has not been done in other parts of the world. No, absolutely not. Countries like China have done this before. Previously, the Japanese also did that many decades ago. So we are moving in that direction. This, in my opinion, when a country has a huge amount of population surplus, even though the country is a low income country, that country can do wonders. So that population bulk, that population pyramid supports the country in moving in that direction of prosperity. Now, if we in Pakistan need to move in the direction of prosperity, then we need to become innovative. And when we become innovative, then we need to showcase that innovation. And that innovation can be showcased using what? That innovation can be showcased using an evidence-based approach. And that evidence can be put out in the form of a journal. Obviously, there are numerous other avenues in Pakistan. In Pakistan, we have somewhere around 3 to 4 journals that are indexed with PubMed and Web of Science and Scopus. We need to increase that more. And I think this is something that institutions can do, but for some reason, the institutions have not been working in this direction, and that has resulted in our researchers facing a bottleneck when it comes to publication. So I think this solves that. And obviously, we don't want to stop at just developing a one journal. We want to move on to become a publisher. So with that being said, if there is any question, please raise your hand and then you can ask that question. This was just the introductory first meeting. I hope this meeting will be helpful. And I hope this meeting will like play the stepping stone. We will have consecutive meetings later on as well. The recording of this meeting will be available for everyone later on as well. So if there is any question, please do raise your hand or please ask directly. We have a small quorum we can manage, and then we can conclude this small meeting that we are having. And I just want to thank all of you for being here. Yes, Dr. Afshin, please go ahead, please. So we have a hand raised by Dr. Afshin, and we can take a question from Dr. Wajida. Okay.
जी डॉक्टर फिनाले philosophy faculty and thank you very much. It's a nice initiative. I come to now. My
Sorry,
question it's
Dr. Afshin, your voice is not clear. If you can please, sorry, yeah, can you repeat again? Your voice is not clear.
can you hear me now?
A little bit better. Yes, please. Go ahead.
Okay, sorry for that because I'm in a place where I cannot uh,
It's okay.
be free
Gigi.
of it's a nice initiative, and I would like to be a part of this, and I'm happy to have it. My question is that would we be opening some kind of regional offices in Pakistan or at major cities like Karachi, Islamabad, or and innovation is only related to AI or it is open to other domains also?
I am sorry, Dr. Afshin. I cannot understand what you're saying. I'm really sorry. Can you just type it out so that I can respond to that? My apology. Okay. Dr. Wajda, if there is anything you want to add to the discussion or to the meeting, please.
My name is Dr. Wajda Parveen. I am physical therapist by specialty and I'm working as associate professor and head of physical therapy department at CMH Lahore Medical College. Moreover, I am serving as managing editor of our institutional journal Med Era, and I have earned a certificate course from University of Health Sciences in medical editing. And I have been associated with number of journals nationally as a reviewer and internationally as well. So it was very
Great.
matter of interest for me, and I appreciate your efforts. I have been looking in different groups, your contribution in capacity building and empowering the researchers, especially our Pakistani young researchers. Most of the points you have raised are very correct. We come across a lot of rejections just because we apply for the waiver and we do not get that much attention. And this idea of establishing a journal is novel and it will be supported. There are many people who will be happy to support. And I can support in my personal capacity, and I will discuss at my institution as well. If they agree, we can go in the mutual agreement as per your terms and conditions. Otherwise, I am there to support this initiative and channel.
Thank you
Thank
so
you.
much. Thank you. So, Dr. Afshin has asked a question. The question is a nice initiative. Were there regional offices or hubs in major cities in Pakistan? At this point, no, there are no major. Like I said, we are initiating this process. Hopefully, if you ask this question from me 6 months from now, I would say, yeah, we have a footprint in Lahore, we have a footprint in Islamabad, we have a footprint in Karachi. Probably that would be we have a big footprint in KP as well, by the way, in Khyber Medical University and Khyber Medical College, because I have a lot of linkages over there, and we have been doing a lot of capacity development in that area. I am myself from Karachi, so I have linkages in that area. So I think major cities, covering major cities will not be an issue. In South Punjab, we have great linkages with people in Bahawalpur and Multan, and a lot of those are like people who are now taking up leadership position, not just in Pakistan or Akhan University, but across the board. I've seen people from there go and take up a lot of leadership positions in US-based universities. So definitely, we would have this footprint, and obviously, we will engage with as many universities as we possibly can. Reason is that initially we want people to start publishing. The indexation happens once you start publishing. It doesn't happen the other way around. Like you get indexed and then you get published. No, no, we have to. And obviously, I am. Even though I created the whole journal system, but the limitation was that where would we get people who would like to publish with us? But in the past 2 years, we have created a huge research group that caters to people across Pakistan, not just across Pakistan, across the Middle East, and not just in Saudi Arabia, but people from Egypt, Sudan, Yemen. I've been working with people in UAE. So it's a whole host of people that we are working in. And definitely, recently I have developed collaboration with Malaysia. And we are working with multiple people in Malaysia. So a lot of them are from the pharmacology sector, but that's a starting point of Southeast Asia. So if we cover like these countries, I think we have a good footprint. And then eventually down the line, if we are good enough, if we develop the indexation, if we have a say impact factor, I think we will attract researchers from the European region or the American region. We will. So I have linkages in African region as well. I have previously, in my capacity working in Aachen University, I have worked on grants with East African countries, Kenya, Tanzania, and also Uganda. So those things are there. We can reach out to that. So we have myself currently I'm based in a small city near Riyadh. So in Saudi Arabia, I have now linkages with multiple university like University of Jizan, universities in Makkah, universities in Dammam. So I think we will have a footprint. We will have a secure footprint across regional offices in Pakistan and Saudi Arabia, but we won't stop there. The registration process of a journal in Saudi Arabia is different from that of Pakistan. Initially, I will initiate the next 6 months just in Pakistan. I want to establish a strong footprint in Pakistan, and the reason I'll tell you why, because majority of my researchers that are facing these issues are in Pakistan. In Saudi Arabia, because a lot of people can pay to the journals, so they don't have a big issue in terms of publication. So the core issue that we are trying to cater is an issue that is of low and middle income countries. So that's that. So I hope this meeting was helpful. The reason why I wanted to record this meeting was that I hope others can hear it. We will put it on a YouTube channel as well, so that everyone knows what we are trying to do. So with that, if there are no more questions, I think we can conclude the meeting. If you have a question, you can raise your hand. So yes, Dr. Saira, I think yes.
Assalamualaikum, Dr. Hassan. How are you? Uh, I'm presently working in uh, Quetta Institute of Medical Sciences, and a bit of introduction. You might be knowing that I have also done FCPS in community medicine. Our college is affiliated with the National University of Medical Sciences, that is NUMS,
Very
and
nice.
NUMS has got its own journal, that is Life and Sciences. So I need to see that MOU that you want to have with these medical colleges, as the college might be interested in asking the university, or the college can take an independent decision to have this MOU with your journal as well, because this is second big medical college in Balochistan after
Right.
BMC, and the students, we have got a lot of influx from Balochistan, and we have got a quota for the Balochistan students as well. So they are doing a wonderful researches. Our department is conducting those researches. Even in College of Nursing, the nursing students are doing wonderful job. So
This
we
is
have to
great.
see that MOU, and
Yeah.
we hope We hope that students will be encouraged to publish, definitely under the supervisorship of a research, a good researcher. But definitely we need to see that MOU that you want to extend to this medical
Yeah.
college, and hopefully it is not going to have very strict sort of bindings on the medical college. So I will also try to convince my college authorities to have this MOU with you and open an avenue for publication, because as far as life and sciences is concerned, there is a lot of competition in terms of publications, and these students might not be getting an equal opportunity, or rather a better opportunity to showcase their research in life and sciences. So I think it is a wonderful initiative on your part, and we would like to be a team with you and work towards this publication and research in health, especially in Pakistan.
Thank you. Thank you, Dr.
Thank you.
Sarah. This is great. And, I always wanted to work with people in Balochistan. I have amazing friends in public health in Balochistan, but problem is that a lot of them are working with WHO, so they are not actually academics. They have been academics, but currently they are not. So what happens is that once you're not an academic, then you lose your motivation to publish, because then you are more in the sector. So I think this is great. I think you can be that nidus of change that we are looking for, and I think there is huge potential when it comes to researchers in Balochistan. And I think this would be great. And thank you so much for this. Yes, the MOU will be flexible. I will share the draft MOU in the group so that anyone who is there, who is not even in the meeting, they can talk to their university. By the way, we will make it as flexible as your medical college wants. So, and it would be great that if it is done at the level of the medical college or the university, whatever is applicable in your context. I think it will be easier for private medical colleges to become part of it. For government, they might require approvals. But regardless of that, this initiative is like, by the way, the MOU is not legally binding. No MOU in the world is legally binding. So there is no risk to the college or the university like that. Furthermore, we are not asking the university or the college for any monetary benefit or any benefit at all, except for the fact that they publish with us, or they provide us with the support in terms of because so why is it, another thing that I just want to add here is, why is it that we are getting regional offices? Why is it that we are doing it? Why can't we just centralize it? We have the people, we can centralize it. I can get people in Karachi, and then we can also have people in Riyadh, and then we can fix things. The reason why we are doing it at the regional level is because we want to make sure that there is a capacity development in every region, number one. So the region office does that. At the same time, we want the region office to develop editing services, so that if the regional office is doing editing services for us, it can do editing services for the for the journal that is created by the medical college later on. By the way, any medical college that aligns with us by default learns how to develop a journal, and then eventually how to do indexation, and then eventually how to raise the impact factor of the journal. And linkages with us help the medical college initiate their own journal. A country like Pakistan, 250 million people, we should have at least 10,000 journals in the healthcare space. In the natural sciences space, I think we should have somewhere around 25,000 journals, but we don't have that. So I think that is an issue. So we want medical colleges who participate with us, who partner with us. We want them to eventually develop their own journals. We want them to develop editing services in their college, in their region. Why? So that local researchers, first of all, we do the capacity workshops. We make the workshop available online for everyone. Anyone can download the workshop, watch through it. And then we want to do assessments in the region. And we want to have ambassadors of the journal in that region. Not someone, we don't want, a lot of times what I see is that we have these centers in Karachi, and people from Balochistan are being represented by people from Karachi. We don't want that. We want the thing to be based in Quetta. And we live in the day and age of the web and online and AI, and we live in the day and age of communication. So I think we can very easily do that. No one needs to. I have worked for people. I have worked with people. I have worked. People have worked for me for years. I'm not talking about 1 day or 2 day, and I have never met them personally. I have hired people who have worked for me for years and I have not met them personally. And they have done a job for years, not 1 day. So we have experience of that. Dr. Amir says, Mohammed S. Amir, great initiative. We can collaborate, inshallah. Thank you, Dr. Muhammad Salman from Peshawar. Thank you. So I think it is Muhammad Salman Amir. I hope I got the name right. Thank you, Dr. Salman. Very grateful for your contribution. So I think we can conclude the meeting here. Thank you everyone for joining, and we will keep on sharing stuff in the group, and then maybe we can have a meeting monthly basis if possible, or maybe we can even have it further on, depending on what is the requirement. And sometimes when things are going on, and we are dealing with individual institutions, so I tend to have just small meeting with the institutional heads. So if the faculty connects us with the dean, we just have a meeting with the dean. We don't have to have big meetings and anything like that. And if the MOU is signed, we just start the work. And then the work and the meetings can maybe happen in the college level. We don't even have to have a meeting at a national level. Yes, we need to then showcase the kind of progress that we have in the next 6 months. So yes, then we can have maybe a biannual meeting or an annual meeting like that. So I hope this is helpful. I hope all of you contribute. So with that being said, let us just conclude the meeting. Thank you, everyone. Thank you for being here. Thank you for being a part of this initiative. It is already 36 minutes. I hope people watch the video. So thank you so much. Take care. Allah Hafiz.